All right. Well, thank you everyone so much for being here to hear our educational information session on self-direction experiences in Massachusetts. We're going to cover some findings from a statewide survey that the Massachusetts Developmental Disabilities Council undertook over the past few months. Just to introduce myself, my name is Caitlin Stober. I am a policy research associate with the Massachusetts Developmental Disabilities Council. I'm also a PhD student in social policy, specializing in disability policy at Brandeis University. I'm here with Jennifer, who can introduce herself.
Hello, everybody. Welcome. Thank you for taking time out of your busy day to join us this afternoon. My name is Jennifer Bertrand. I'm the Deputy Director here at the Massachusetts Developmental Disabilities Council, and I'm also a parent. I have an adult daughter who experiences autism and an intellectual disability.
For folks who aren't familiar with the Massachusetts Developmental Disabilities Council, or MDDC, our mission is to empower individuals with intellectual and developmental disabilities and their families to lead successful lives in their communities by promoting self-sufficiency, community inclusion, and opportunity. We are federally funded, but we're an independent state organization. We are
Caitlin,
also part of
and I,
the MA. Oh, sorry.
oh,
Yes,
and
Jennifer.
Caitlin, I just wanted to mention we've got a couple of guests here today. We have Tim Cahill from DDS, and I believe we also have Brian White from DDS joining us this
Oh, well,
afternoon.
welcome. We'll definitely have some DDS shout outs in this presentation when we talk about the support we received to roll out this survey. So I also just wanted to share that MDDC is one organization that's part of the MA21 Coalition. And I believe Robert is here from MA21, and we have a slide to introduce what that coalition is and does. Robert?
You're not getting nachos today.
Okay, can you hear me okay?
Hey,
I'm Robert Beckett. I'm a
hey,
volunteer with the MA21 Alliance. I have a son with Down syndrome who's 47, lives with me and my wife here in Jamaica Plain. And MA21 is an alliance. We're not a nonprofit corporation separately standing. We don't have a board of directors. We're a group of volunteers that try to keep this alliance together. It's been going on for close to 20 years and started before the Real Lives Law. So it's really a partnership of self-advocates, family members, and then advocacy organizations. The Mass Developmental Disabilities Council has been a great member, and this is this presentation that we're making today, although it's not directly tied to MA21, it's a part and parcel of what MA21 is trying to accomplish. And the Arc of Mass has been a great supporter. They've developed our website. They helped us do the library and just tremendous support in terms of webinars that we've been putting on for the last couple of years. And just briefly, the Disability Law Center and the Massachusetts Developmental Disability Council are very instrumental in providing comments to the Arc of Mass comments on the October 22nd DDS regulations on the Real Lives Law, which were withdrawn, and then finally the October 2024 regulations, which were adopted, which are critical regulations because they finally established that the individual budget must be tied to the traditional cost of services and as well as need. And they also specifically provide that for the minimum qualifications of independent facilitators, which now provides a base for there to be independent facilitators. So the advocacy groups have been tremendous. The Massachusetts Families has developed our fact sheets and so in plain language, and then has translated those into Portuguese and Spanish. So we're grateful for everybody's participation. Thank you.
Thanks, Robert. I am going to introduce this survey that we conducted, and we certainly did it in part because of our involvement with MA21 and our dedication to self-direction in the state. Some folks might not be familiar with what self-direction is, so I wanted to provide a very brief explainer. in Massachusetts, in all states, people can get services in different ways. Most people use a traditional model for service delivery, and this is when a provider agency is responsible for your budget, your support staff, and your programming, like maybe a community-based day program or different employment supports. Some people, however, use a self-directed model of service delivery, and that's really what we're talking about today. In this model, people receiving services in their families have or share responsibility for planning and managing their own services. So this can include things like hiring and firing your own staff, your support staff, managing your budget, and using it for the services and supports you need. DDS has a good link about what self-direction is in Massachusetts, so I think one of my colleagues can drop that in the chat for people who want to read more. So we conducted this self-direction experiences surveys to really explore the experience of Massachusetts residents. There was some data gaps, and we really wanted to hear from people in the community about how things were going. And we wanted to do this to share the information back with community members and DDS so that folks know how things are going, what's working well, and what can be improved. We developed this survey using some established self-direction measures that are present in the Human Service Research Institute's National Core Indicator Survey that states can volunteer to participate in. We had tremendous feedback from the MA21 Coalition for input about how to change our questions, what to include, how to edit it. And we had tremendous input from DDS. So they really helped us add some detail, learn about the different regional offices, make sure that we're asking questions that will help them understand the state of things. In terms of administration of the survey, it was really a community effort. We are so appreciative for all our community members who helped us recruit people to participate, and we were blown away by the responses. I will say we presented an early preliminary findings, you can say, of what we learned a few months back to the MA21 Coalition, and since then, DDS and others in that coalition have really helped us recruit additional folks to take part. So the folks who participated in our survey, we ended up with a total of 259 participants who had completed at least some of the questions. The majority of folks were family members, so 84% identified as family members. 10% were people with intellectual and or developmental disabilities using self-direction, and 6% of folks had a different relationship with self-direction. There's two different ways that people can self-direct in Massachusetts. The large majority of participants in this survey use participant-directed programs. So that was 81% of our participants, and 9% used agency with choice. We had some folks participate in some questions of the survey who were interested in self-direction but still are waiting for services. And then we had some people who weren't sure or clear about their relationship with self-direction. We made it optional for folks to share certain demographic information about themselves, so we didn't collect information from everyone, but 174 of these 259 participants did provide what region they live in Massachusetts. So we were able to see that we had a fairly decent spread. All regions were represented. 28% of participants came from the Northeast, 19% from the metro region, 38% from Central West, and 15% from the Southeast. So like I said, this isn't necessarily everyone who participated, but it was good to see that we had outreach in all regions. Before I share the findings, I wanted to share a little bit about how we collected the information because we did it in different ways. First, sometimes we ask participants to choose an answer from different options, like yes, no, sometimes this applies to me. And this helps us understand the proportion of or how many people have certain experiences with self-direction. And we created charts about these findings to kind of look at that proportion. We also invited participants to provide open-ended responses, and this helped us really understand the unique stories, more in-depth experience about what people were facing in their day-to-day lives, and we share selected quotes to illustrate these findings. And with that, I'll get into sharing a little bit about what we learned. I want to start with talking about why people chose self-direction. As we stated, most people in the state of Massachusetts do use a traditional model for service delivery. So why do people choose self-direction? The large majority of participants said that they, were interested and chose self-direction to increase the choice and control they have over their or their family members' lives, and experiences. We also had 64% say that they wanted to increase flexibility and freedom in how they could receive and use services. 61% said they chose this to have personalized supports, things that were molded to them in their lives. 49% said they wanted some improved independence and autonomy over their budget and services. 47% said they wanted more community engagement, specifically more meaningful opportunities to be included and engaged in their communities. 28% of people said that it was recommended to them by DDS. 15% said it was recommended by other family members or friends who maybe used self-direction or knew about it. And then 12% of people said traditional services were not available or maybe didn't suit their needs as well. There was some context around that. I'm going to share some quotes that reflect each of these reasonings that people had for choosing self-direction. And the first is that notion of increasing choice and control. So one individual self-directing shared with us, I chose self-direction because I want to have more control over my life, who supports me, how I spend my days, and the goals I'm working towards. It lets me build a team I trust and create a life that really fits me. We had another person talk about the flexibility and freedom that they felt self-direction afforded. The individual self-directing noted, I love self-direction because it allows me to access activities and supports that I need and want. I love Unified, who I do virtual workouts with. I should note, I'm so sorry to interrupt this quote. I changed the names for a little bit of anonymity here, but I love Robin. I cook with her. I love my art therapist, Mary. I have a therapist. My brother Rob is a great role model for me, and we do fun things. Being able to Uber to my job on Tuesdays and sometimes you're with us at Gordon College. It makes me very independent, and I love that. And this individual's mom also added their own note that said, we love the flexibility of self-direction and the ability to explore new things or shift as things like available mentors or programs shift. Someone who highlighted their appreciation for personalized support said, not everyone has the same needs, and the participant-directed program lets us decide and try different things we think might work well or help. And if they don't, we can change it and try something else. In terms of more community engagement, a family member explained, when we have staff available, my daughter's in the community every day, working part-time, volunteering, doing something she loves, going to the gym, learning, and practicing independent living skills. She enjoys the choice and freedom, and she has and feels bad for her friends who sit at home or in programs. She lives a meaningful life. So for this family member, they were talking about how self-direction was specifically an avenue to increase that community engagement because they felt like some of the community-based day programs perhaps were inadequate. And we'll have some more quotes and stories about people who had similar sentiments and experiences. In terms of increased independence and autonomy, an individual self-directing said, I get to choose my own staff and I keep people I trust. I like being able to plan my own schedule so I can balance my support time with my work. So for a lot of folks who were doing work in had employment in the community, self-direction was a way to get the supports they needed that had a flexible schedule that allowed them to continue doing that and manage their own schedule as well. So while some folks indicated that traditional services were not available at all, perhaps in their region there wasn't a service or support that they were seeking, a lot more people indicated that the traditional programs that were available weren't appropriate or adequate for the needs of themselves or their family members. So this family member explained, traditional program options were wholly inadequate to meeting the goals of my son's life, to continue to develop skills to participate in life in the community. We had a number of people express similar feelings about this. Some people said maybe because of complex medical diagnoses or higher support needs that traditional program options in the community wouldn't accept or weren't equipped to work with their family member. So now that we covered a little bit of the why people chose self-direction and maybe how some of those reasons actualize in their self-direction experiences, we're going to build on that to talk a little bit about wins and what people said is working well for them in the self-direction program. Overall, people with intellectual and developmental disabilities are involved in decisions about self-direction. They report experiencing personalized services and supports, control over services and supports, and really exercising and enjoying the authority to hire staff and people they want to work with. So the next kind of few findings, we're going to share some of those charts that show the proportion or how many people responded in a certain way and match that with some quotes that explain people's experiences. So when we asked who makes the decisions about your self-directed services, 18% of respondents said myself or the person receiving services. 41% said the person receiving services has at least some input. 28% said a family member or friend or person receiving services, and 13% said something else about who was maybe making the most of the decisions. So when we look at this, we've got nearly 60% of folks who are themselves leading or have substantial input into their self-direction services. One person self-directing said, "There's so many things in the community I choose where I go to work. I choose where I go to work, going to school, volunteering, self-advocacy groups, singing lessons, going to the gym, going to see plays." So this person was able to say, I have a self-direction budget. These are the things I like doing. These are the things I want to do, and I'm going to be able to use my budget to make those things happen.
Excuse me,
Jennifer,
Caitlin. Yeah, I
yes.
noticed that there was a note in the chat. Some people might not really understand what traditional services are, so I'm going to drop a link to that. I didn't know if you wanted to, say something quickly about it, but I will also drop a link to a DDS website page that talks about traditional services in Massachusetts.
Okay, thank you so much for interrupting me. I'll give a brief explainer and then maybe we could talk more about it at the end too. But when we talk about traditional service delivery, this means a provider agency, someone who is responsible maybe for the Medicaid waiver program that you use to get your services and supports in the state. So that provider agency is the one that says, these are the ways that we can use your money. You can sign up for this community-based day program. Maybe you live in this group home and the people who work in the group home are your support staff. Those are different ways that people might experience services that they did not themselves choose, but the state is supporting them, to live their lives. In this case, in community settings, even if it's in a congregate setting like a group home. So the main difference then is self-direction. Instead of somebody else making those decisions, when those decisions are made, nobody is looking at the money, how much money is spent. They just get the services they get. When you have self-direction, you are provided with a certain budget amount based on your needs, and you get to choose how you use that money. So some people exercise a range of creativity in how they get the services and supports they need. For some people, this means hiring support staff that they trust, maybe a neighbor, a friend, a family member, versus if you're getting a traditional model of service delivery, you don't get a say perhaps in that support staff situation. So that's one explanation. I hope that helps a little bit, and I'm happy to have a conversation again after this. We also asked folks, are the service and supports you received personalized to your needs and goals? 7% said no, 15% said sometimes, and the overwhelming majority, 78% of people said yes. And two family members commented on this, and they used similar language, which I think illustrates how people are thinking about self-direction and some of the benefits. One family member said, "My son is really able to mold his programming for what he needs. He has a combination of community-based day services, employment support, in-home support, and flex funding that covers his recreational expenses." Another family member said, "Self-directed choice allows us to create a mold that is fitted just for our daughter. In so doing, we don't have to force her into other molds that were created by others for other clients." So this idea of a mold, and sometimes when maybe traditional services, it's a one size fits all, everybody participates in this one program. These family members were happy with the fact that self-direction allowed them to kind of tailor something to their family member, with their family members, and to their family members' needs and wishes. For choice and control over services, we asked, do you have the amount of control you want with the services you self-direct? 13% said no, 21% said in between, and 66% said yes. I should qualify that the folks who said no or in between, that provided additional rationale or reason why they said that. For many folks, um, maybe what they wanted to do, they couldn't find the staff or an avenue to make that happen, which is definitely a barrier we'll talk about a few slides down the line. But so many folks, 66% said yes, they do have the amount of control they want. This family member said, choice in staff that my son likes to be around and that are qualified to help him and enjoyable for him to spend time with. Ability to do what my son wants, play sled hockey, drum in a band, work at Fenway Park, go to the gym. My son needs help with all of this, and self-direction provides that support to let him live his life in the community. So we like these examples. We're really getting to know these folks receiving services as the individual people they are. This person wants to play sled hockey, they want to go to Fenway Park, and having self-direction has allowed them to hire support staff that are able to support them in doing these individualized activities and initiatives. In terms of hiring staff, do you feel like you have employer authority, which means that you are in charge of hiring and firing and managing your staff? 6% said no, 12% said in between, and most people, 82%, said yes. They feel like they have that employer authority. And this was really important. One family said this provided freedom to hire personnel from similar cultural backgrounds and racial identities. So this was really important to them to find someone that really fit with the within the cultural background of their family member, and they felt safe and comfortable and trusted with. Another family member explained, my brother requires a one-on-one support, and he's had a lot of really bad ones. Self-direction allows us to pick our own person. So in this case, it was almost a reaction, right? This person had had some negative experiences with some support staff. So they and their family want to be really careful in who they hired, who was able to meet the needs and support this individual. So in this way, a theme emerged of self-direction as a response to the direct care workforce crisis. At a national level, not just in Massachusetts, we know that there are not enough direct care workers like direct support professionals to meet the needs of people with disabilities and aging adults across the country. This is fueled by high turnover, low wages, and it's something that state and federal policymakers are working on. And so people kind of indicated that they chose self-direction because of experiencing challenges with staff in other delivery models. So this family member explained the community-based day service serving both my DDS served sons goes through good waves. When the staff take the guys into the community, and waves of low staffing where they sit around and do nothing in the building, the antithesis of the term community-based. By self-directing 2 days a week, I get 2 days where I can assure my sons follow their interests and don't just sit around. So this person was saying like, hey, the community-based day service might have been a good setting for my sons when staffing was adequate and when they had the capacity to support people to be engaged in the community. But our lived experience was that that wasn't happening because staffing levels were so low. So to build on this, self-direction was seen as a pathway to hire quality and trusted staff specifically. So this person who self-directs shared their personal experience that they I worked with a caregiver before living in a certain group home while I was still on the street. Then, when I was with a group home and when she retired, she was asked to come back to work with me. I'm glad because I trust her and she treats me with respect. A lot of people don't treat people like me with respect. They think we are less. And so for this person, having self-direction allowed them to work with someone who they trusted, who they felt saw them in their full humanity. And I can say there was a number of stories like this. This is just one quote that really affected me as I was so appreciative of people sharing, of people feeling like they had negative experiences with staff in other settings who just did not respect them. Oh, okay. So while self-direction was acting as a remedy in some ways to the direct care workforce crisis, it is not immune and is also affected by the direct care workforce crisis. So this family member said, there's a financial, physical, and emotional toll on our family. Also, in 14 years of doing this, there has been no change in our budget, although I am just now starting to address this with DDS. Up until now, the budget has worked because it's been impossible to stay fully staffed at any time due to the workforce crisis. I need so many staff people because we cannot offer full-time benefits due to our agency with choice partners' unaffordable health plan costs that would be passed on to my son's budget. So this has a number of themes that we will talk about again later in the presentation, but one thing to note is this person has had a budget that didn't really meet their full needs, but the reason it worked was because even if they had a bigger budget, they weren't able to find direct support professionals to hire, even in the self-directed model. So if they didn't have personal contacts that were kind of on tap to hire and they were using agency with choice and trying to find a pool of direct support professionals, they've been having a really hard time staying fully staffed. All right. So self-direction, as I noted, is a model that is used across many states that have different policies and laws. In most of these states, you are able to hire and pay family members to provide services and supports for you. There are some restrictions in Massachusetts, namely a legal guardian or someone who has legal authority in any capacity cannot currently serve as a paid family caregiver. We're going to talk a little bit about some opportunities to learn more about that and weigh in at the state level at the end. But I wanted to provide some information about in our survey how many people said that they were paying a family giver through self-direction. So 61% said no and 37% said yes. A small percentage of people said they weren't sure. This rate actually might be a little bit higher of people not using a family caregiver than in other states because of some of the laws in Massachusetts. And this family member in the survey actually shared a little bit about their experience with that. They said, I would like to see the ability to pay family members be less restrictive, especially the ability to pay guardians. When the guardian has to step up in to work and complete the same activities the paid staff is, but is unable due to illness or vacation, they should not have to do this without pay. So this is kind of striking at a challenge that is bigger than we have time for in this webinar that talks about the balance of unpaid family caregiving and informal supports and that formal paid support as well. We're going to move on to talking about some self-direction experiences with challenges and maybe areas for change specifically. I want to preface this by saying, some of the overarching areas and challenges people noted were the need for more information about service and support options, the need for more support in finding and hiring staff, some support with the financial intermediary acumen, which is the platform not being accessible, but people in the participant-directed program specifically use this. And then the last one being that budgets are not enough to meet service needs. I will say, as we kind of shift gears and talk about challenges people are experiencing, when I say that people were so generous in their responses to this survey, I mean that we had over 50 pages of single-spaced text, of stories and open-ended responses that people shared with us. Almost half of this was people writing about challenges that they were experiencing. So this is something that certainly people wanted to express and to see represented when we kind of shared our accumulation of findings. So on the whole, we kind of asked people to check off as many as they wanted of additional support needs they had when it came to self-direction. 36% of participants said they needed support with information about what service and supports you can get. 29% said they needed support finding or keeping the staff they want. 27% said they had needed support with financial intermediary services, specifically Acumen, which has been a recent shift. A previous broker was doing this before. 14% said communicating with service coordinators. 11% said managing benefits for their staff. 9% said getting staff paid. 7% said planning service needs and scheduling staff. 8% said training their staff. But only 16% said they didn't need help with any of these things. And many people said that they had other support needs that we'll get into with some of those quotes that people share. So to start things off and talking about the availability of services and supports, we asked, are the services and supports you want to self-direct always available? 32% said no, 32% said sometimes, which meant only 36% or a little over a third of people said yes, the services and supports they want are always available. One person explained this, who said that, the service and supports weren't always available, explained, we would like more flexibility in how we can use our self-direction funds to support my son's person-centered plan. We are still in a space where I feel we hear about a support that's available only to then hear it's only available under certain conditions, like agency with choice instead of participant-directed program or traditional services, etc. Being able to have the services really meet the needs of the individual without restricting people to certain programs or codes would be helpful. A number of people kind of had the same feedback that there was a lack of transparency in what you could get and what certain codes meant, that people requested additional support and information about. On our previous presentation, when we presented this to the MA21 Coalition, we did have people ask if there was differences by region that people lived in. So I provided a breakdown of how people responded to this question about whether the service and supports they need are available to them. These just need to be taken with a large grain of salt. I will say that the differences by region were not statistically significant. So when I used my statistical programming to kind of look at, were these by random chance, these differences, or was it significant at a statistical level? It was not significant at a statistical level. Also, it's important that this now restricts the people responding only to the people who shared their region with us, which, as we know, was about, 170 of the 259 people. So we lose respondents then when we look at these regional differences. But I included the charts because people asked about it last time and might find it interesting. But basically what we see is a higher level of folks in the metro area saying the services and supports they want to self-direct were not available to them, versus in the Northeast, a higher proportion of people were saying, yes, the services and supports I need were all available to me. If folks have more questions, we can talk about this, but we'll move on. So the next thing that was a really big theme in terms of challenges was this access and understanding of the Acumen platform. So this is only among participant-directed program participants. Sorry, that was participants twice in one sentence. But basically, this is not something that the agency with choice folks use. But as noted, 81% of the people who responded to this survey were participating in PDP specifically. So it is a large number of our respondents here. We asked, are you able to access information about your budget and services from Acumen? And 67% said yes. I know this seems good. The majority of people said yes, but it should be 100% because this is the only way people can access information about budget and services is through this platform. Someone said Acumen is a big issue. It's not user-friendly, not for the staff, and to me managing the services. When we followed that up to ask, is the information you get from Acumen easy to understand? 33% of people said, no, it is not easy to understand on my own. 45% of people said some information I can understand, or I just need help to understand it. And only 22% of people said, yes, it's easy to understand on my own. And I want to highlight again that the majority of respondents to our surveys were family members. So when we take that into consideration, this is a platform that is supposed to be accessible and understandable for people who are self-directing their services. This includes people with intellectual and developmental disabilities who are self-directing their services. So accessibility and understandability is very important. One family member kind of summed up their challenges saying the fiscal intermediary, which is Acumen, needs to be a simpler format with ability for simple access and viewing. Acumen is way too complex. I don't care to analyze information many different ways. I just want to see the basics. Who the providers are, have they been paid and when, and what has been spent in each category and what's left. So some additional quotes on this theme of the Acumen platform being difficult to understand, which I do want to acknowledge, DDS indicated this wasn't a surprising finding. They have heard feedback prior to our survey about the challenges, and I know it's a priority for folks. But this person said, my experience with PPL, which was the fiscal intermediary before Acumen, and Acumen has been frustrating and at sometimes totally unacceptable. DDS needs to pressure Acumen to update its technology with regard to time entries, approval of hours, identifying budget numbers, and being able to access budget data in more comprehensive formats. Implementation of Acumen was a disaster, which has leveled out, but the technology platform is marginal at best. And many people kind of tied this experience with the financial intermediary Acumen to a broader notion of administrative burden. Um, so one person was saying, submitting forms for reimbursement to my DDS office is an onerous process that requires me to purchase a PDF converter program at my own cost, then convert receipts. My current PDP program manager rejects screenshots and photos of receipts, when in the past that was acceptable. This creates more work and more time for a family.
No, I'm
I
not
was
really.
going to say hi, my meeting with Steve went well.
Oh, sorry. I think that we just had someone muted. Thank you so much for muting. Another person said the budget process is not user-friendly. From the very beginning of the process with DDS, PPL, and now Acumen presents a tremendous amount of paperwork, which drains our time even more. So people are tired, they're trying their best, and they're having trouble accessing. Some people did indicate that not only was this burdensome and tiring, but it was directly impacting that family members or individuals were going without services and supports because the platform prevented payment of staff. Staff left because of some of these challenges. So people definitely expressed a number of challenges in relation to this. Moving on to talk about some other challenges, which is adequacy of budget. So we asked folks, is your budget enough money for the services that you need? 40% said no, 28% said sometimes, and only 32% of people said yes, that the budget was enough to meet their service and support needs. One family member indicated, our son's needs have significantly increased, and we will need to give raises to our staff to keep up with the increased needs. He has an intellectual disability, and this year he suffered an accident and now has a spinal cord injury. We could use more support on non-traditional days, like weekends and evenings. Again, we had some questions last time about breaking this down by region. So I did that again to say how many people said their budget was adequate by region that they resided in. Again, these differences were not statistically significant, so take them with a few grains of salt. And it's only based on respondents who deem to share this information with us. But again, we kind of see a similar trend in that more folks in the metro area were saying, no, my budget's not enough. Whereas in the Southeast, more people said that the budget was enough to meet their needs. Okay, there we go. We asked, have your service and support needs changed during your time using self-direction? About half of people said no, but a half of people said yes, they have more needs. Um, this was something that was reflected in the last quote I shared, but again, this person said, oh, I must have included the same quote. And I had so many to choose from. I'm sorry about that. But again, this idea of like people age, they acquire additional support needs, or people acquire other disabilities through, in this case, an accident. So the inadequacy of budgets coming in two ways. One is that there's an increase in needs, and then the budget doesn't increase in kind. And then the other is just the budget itself is falling short. So what I did to provide some more granular details about some of these budget shortcomings that families were talking about is I looked at the past 3 years, 2025, 2024, and 2023, and looked at how many people for this year specifically discussed a needs changed and then whether or not the budget changed in kind. So in 2025, 48% of people said they had an increase in needs, whereas 45% of people said that their needs stayed the same. Yet, in terms of budget, 71% of people said their budget stayed the same. Only 11% of people saw an increase in their budget, and 6% of people saw a decrease in their budget. And when you look at these kind of different cells of where these people are falling, what I found is that in 2025, only 16% of people who had a needs increase also had a budget increase. And this is again not based on our full sample because only some people knew this level of detail and deemed to share it. So this was based on a little over 100 participants. Also, some people, self-directed at different times. We asked this question for 10 years back, but we're only sharing it for the last 3 years. In 2024, we saw similar trends. 44% of people expressed an increase in their needs, yet 75% of people said that the budget stayed the same, and only 15% of people saw a budget increase. When I break it down again, 28% of people who had a needs increase had a budget increase. And then again in 2023, this is just showing that there is a pattern, in fact. But 41% of people said they had a needs increase, yet only 13% had a budget increase. 77% said that budget has just remained the same. And when I break it down kind of by category, in this year, 20% of people who had a needs increase saw a budget increase. All right. So we did have a lot of people share stories about the challenges with the budget and how their budget was maybe not enough to meet their service and support needs. This family member explained, "We are glad and grateful to be part of PDP. However, we are very concerned that this year DDS received a rate increase for day programs, but has not applied these funds to group day activities under PDP, even though the day rates for the program have increased. This poses a real budget challenge for our family." So what this person is explaining is that in traditional service um, delivery models, that there's an increase in rate for some of these day programs or different activities in the community, and that's automatically covered if you're using a traditional service delivery model. But when it comes to self-direction, these rates are increasing, but the budget's not increasing to cover these rates. And this was really challenging that family's budget. Similarly, this person explained, "We have been involved in self-direction for 8 years. Our budget has not increased in 8 years, despite showing need and having to offer increased hourly rates to hire staff. This is not sustainable. Traditional programs have had increases. Why not self-direction?" So this person's explaining that they've been in self-direction for 8 years. We had people say, "I've been in self-direction for 5 years. I've been in self-direction for 14 years," and express similar frustrations with the budget not keeping pace and this impacting their ability to find and maintain staff. Which is our next theme. I got ahead of myself that the inadequate budget is exacerbating some staffing challenges for folks. This family member explained, "My daughter's budget is helpful, but it no longer reflects the true costs of providing quality support. Staffing rates have increased significantly, and it's becoming harder to retain skilled workers within the current budget limits. An adjustment that keeps pace with rising wages and service costs would help ensure she can maintain consistent, safe, and meaningful support through self-direction. And just a few more on this theme is that another family member said, as previously noted, because they'd provided a number of open-ended responses for us, budgets should increase annually. Initially, we paid staff $25 an hour. We now pay $35 an hour. This can't continue. Needs increase as you age, costs increase, but the budget does not change. I was not aware that we could appeal our budget. So in our survey, we did have some questions around if anyone had engaged in an appeal process before. And so the first time someone was introduced to this notion that that was an avenue they could pursue was in our survey. This Another family member said, my son's aide works only 6.5 hours per day with no health insurance, no retirement plan, and no vacation time or sick time. Pay scale has to be increased to maintain good staff. All right. So we're almost to the end, and I think we're going to have some time for questions. I just want to thank again people for listening to these stories. I think people were so generous in sharing their experiences and their family experiences with us, and I think it's was really an honor to collect some of those stories and hopefully share it out with this wider community. We're going to open it up for people to share thoughts or questions, but first I'm going to share a few opportunities for people in terms of advocacy or next steps if you're looking to pursue more education or involvement in this area. So one opportunity is House Bill 1394 and Senate Bill 886, an act relative to family members serving as caregivers. As I stated, there are restrictions about who can be a paid family caregiver in Massachusetts. Currently, family members with legal liability, like guardians, are not allowed to be paid as caregivers in self-direction programs. And this bill is proposing changing that restriction for all home and community-based service programs and settings. So you can track this bill if this is something you're interested in learning about or have experiences with and want to contact your representatives. You are welcome to do so. We are happy to provide educational resources about how you can do that and materials if you want to share. But you can track this bill's progress on MDDC's page of our priority and endorsed legislation, which I think someone can put in the chat eventually. So we'll put that in the chat for you all. Another opportunity, so this study was based in Massachusetts, and I just want to share that researchers at Brandeis University in Massachusetts are doing a study about self-direction across the United States. And they are specifically interviewing people of color and their families who self-direct services. So if you're interested in participating in this opportunity to share your stories with at a national level of analysis, I encourage you to reach out to this email. You can also reach out to me and I'd be happy to refer you. Participants would be paid for their time. Some other opportunities to stay connected with MDDC and just involved in our disability and advocacy community. MDDC and the ARC of Massachusetts are hosting a virtual advocacy training ahead of the annual legislative reception, which I'll talk about on the next slide. Probably should have switched these. But this training will teach you strategies to share your story with legislators, and you can learn and register for the training at this link that's in the slides that we'll share. We'll also put that link in the chat for folks. And this is taking place on February 3rd, next week. And again, that training is in preparation ahead for the annual legislative reception, which is an event that MDDC hosts in partnership with the ARC of Massachusetts. This is happening at the Massachusetts State House on Tuesday, March 10th from 10 to 12. It's a great time to meet your legislators and other members and advocates in the disability community. It's also a time where we get to honor legislators who have really made a commitment to the disability community here in Massachusetts. So there's more details and registration information to come, but if you want to put that date on your calendar, we'll see you guys there. And lastly, we appreciate everyone hanging on for the time they have. We will open up to questions. Just a shout out that when we do webinars, we really appreciate participant feedback so we can improve the education we provide to our community here in Massachusetts. You can either scan this QR code or there's going to be a link in the chat that we'd really appreciate if you could click on and just provide a few quick indicators of how this went for you. And with that, I'm going to leave our contact page up for a little bit. Thank you so much for attending and listening in. I can leave this slide up or I can turn the slide off so we could see faces, and we'll open up to questions or comments from folks.
Caitlin, we have some really interesting and good questions that are in the chat. Do you want to make your way through while I continue to put the links for the legislative reception and our webinar feedback? We hope that you will complete our quick survey. We do federal reporting, and it's important for us to track this.
Okay, let me go through the questions that I've got from folks. One individual asked, how do people find staff to hire? What is the average number of hours per week? Do they hire staff? It must be limited by the budget. Can they pay more for less hours, or is that fixed? What is the average duration of an employee? In other words, how often is the turnover? How do self-directed families work around labor laws that do not accommodate support staff for my ability to work? A young adult, maybe YA, who isn't eligible for MRC or other or more independent work. Okay, these are a whole host of great questions. So, how do people find staff to hire? Well, this is a good question and something some people indicated they need more support with, actually. They would love to see maybe a pooled resource of tried and tested direct support professionals, but a lot of people leverage their own personal networks when they use self-direction. Maybe they've met people through different activities or engagements, family members, friends, neighbors, or there are, agencies that manage direct support professionals that people are able to contact and work with as well. The average number of hours per week that someone might use or maintain staff varies so much depending on the person using self-direction. And that's one of the benefits of self-direction is my needs are different than someone else's needs. So it is limited by the budget, and it's that person's choice how they use the budget. They can use that budget to maybe try and hire and pay support staff. They might use that budget for other things as well to meet their support needs. The pay rate that they pay their staff is up to them. That's one of the things that people have in self-direction. They get to choose that rate. When people talked about increasing rates and things like that, part of the reason was it was coming down to being competitive. So if they want to hire someone who they trust, they think is good at their job, they worry that if they don't pay them more or enough, that they'll go work for someone else. So that was part of that challenge. Average duration of employee turnover. That is not possible for me to say on a case-to-case basis. There is information about average rates of turnover by agencies within our state. I'm not sure. I have to double check if Massachusetts participated in the direct support or the direct care workforce survey that the Human Services Research Institute based in Cambridge does for states, across the US. That's a resource that when I get to catch my breath, I can drop in the chat for folks that shares a little bit of a zoomed out picture of the state of the workforce. Managing labor laws, in terms of making sure that all staff are hired legally and following laws, I think that there are some supports within DDS to help folks make those choices. If you yourself are interested in being a direct support professional, I think that there's different avenues that people can take to be trained or hired to do such work. And I'm not sure about other restrictions. But I'm happy to, if you send me an email, I'll try my best to help you out with that. Wonderful. Someone asked about the difference between the participant directed program and agency with choice. This is a great question. I'm sorry I didn't spend more time on this. Jennifer followed up with a link in the chat to the DDS website that outlines this difference. In a nutshell, agency with choice is a little bit more of a hybrid in which they are working specifically with an agency to help actualize their choices, but they might not maintain full responsibility or control over budget and hiring staff. They're just working more individually with an agency to help them do that. Whereas participant-directed program is the most responsibility, choice, and control that a person can have in the self-directed service delivery model. And that means you and or your family are responsible for all aspects of that. And the support that is given is through that financial intermediary, which is Acumen. So that's the platform by which DDS, has contracted with them. They show you what your budget is, and you use that system to make sure the staff you hire get paid, hired, and so forth. Can we get a copy of this webinar? I came in a little late. I'm so glad you joined when you could. Absolutely, we will be sharing out both a recording of this webinar and the slides, and my contact information is on that. So if you have any questions about the slide material that weren't answered, if you watch the recording back, you're more than welcome to reach out to me. How far west to collect data? Oh, that's a good question. So I did have, like I said, it was completely optional for people to share what region they were residing and receiving services in. We did ask a question more locally about what local office folks were working with. And this is largely because DDS worked with us to make sure that all local offices had this survey to share with people using self-direction. So I don't have the information in front of me to say the most west place we got in terms of response, but I can say that with DDS's help, we made sure it was shared out with everyone as far west as it goes. Um, For, okay, we've got a question that says self-direction gives adults with IDD autonomy, dignity, and empowerment to live a more fulfilling life. For aging parents who currently direct services, what supports need to be in place to ensure continuity and sustainability for their loved ones as parents age and gradually step back? This is a wonderful question, and I'll get, a little emotional about this actually. It's something that came up in a number of stories of people who were self-directing as a family unit and family members expressing a lot of concern about the future and what happens when I'm not here to help maybe my family member direct these services. What I can say is that future planning is, you know, kind of can be used colloquially. It's also an effort that people are doing in the disability community to try and make some of these plans for what happens as maybe family caregivers or family members age or pass away. And so there's a number of resources out there about future planning, including template workbooks that you can fill out with your family member. It might include things about finances. Maybe you use a trust or an ABLE account, or how will my family member have access to money and things like that. So I would highly encourage you to do some looking up about different templates around future planning that work for you. And again, I'm happy to try and send some resources your way if you send me a note.
And
I'm
Caitlin,
gonna take a
we can
breath.
also we'll be doing a follow-up email to all those who registered today to share the link to a direct link to our website once it's uploaded of this recording today. And we'll be also producing a one-page, two-sided resource with the key summary findings. And Caitlin and I will work to include some links about what she was just discussing about that future planning.
Absolutely. And I think it's a little bit of a delicate topic. It's not like me in my capacity working with the MDDC would endorse one way to do this or another. There's a number of resources, and I think there's options out there to hopefully find something that works well for you and your family. If agency with choice gets a cut of the money, oh, and also, I'm so sorry. I'm going to pause here. I recognize that we're past 5 p.m. Thank you so much for spending this time with me. I am happy to stay on and answer all these remaining questions if you're able to stay on. But if not, like Jennifer said, we will be doing email follow-up to get this information out to you. If agency with choice gets a money cut of the allocation to do this work, do the caregivers who do PCP get a money cut? How many hours of work is this for the parent caregiver doing all this PCP work? Thank you for this question. The short answer is no. There is no mandate that a family member is getting paid if they are providing support to do self-direction. And in fact, a lot of people shared in their experiences with us that sometimes this feels like a full-time job, managing staff, just keeping track and hiring and making sure people are getting paid as they need to, making plans about programming. Um, so, as noted, it is possible to pay a family member through self-direction for support services, but this has some restrictions. But the short answer is no. Another question. Can you explain how a participant-directed program is funded? Example, how much does the state pay and how much does the federal government reimburse Massachusetts? Oh, this is a great question and kind of a tough one for us right now because services are mostly funded through Medicaid and Medicaid waiver programs. In the United States, you might have heard in the news that there's a lot of changes to funding of Medicaid at the federal level. So in every state, it differs based on like how much the federal government reimburses and how much Massachusetts covers. But kind of a summary without a number in front of me is the federal government usually was carrying a lot of this, upwards of 50% of the costs. And one concern we have heard from many members of our community right now is that the federal government has proposed tremendous cuts to Medicaid. And what does this mean for our state's ability to maintain services, specifically home and community-based services? So, people who use self-direction are generally living in a community setting, whether that's a family home, in their own home or apartment, or maybe in a group setting. And
Kate,
how the federal, yes,
yeah,
sorry, should I not?
this is a pretty deep question,
Okay,
and I don't know if we defer to Tim, who's here,
okay,
or if this is a question that we could pass on, or I think
okay.
email, and we could get you connected with someone who can give you
Yeah.
a more um,
It
thorough response. And
It is a lot. We did do a whole webinar on Medicaid, so that's a resource we can give you from the DD Council. I'm happy to have individual conversations. Jennifer was right to interrupt me because I could talk about Medicaid all day long. Tim, if you do have anything you want to jump in and share with this person, feel free, but there's no pressure. Um, we will, it's a complex issue, this terms of allocation of funding, and it is a main concern right now because of federal cuts.
if you put your email in the chat or you reach out to one of us directly, we can help you get in contact with someone who could, answer that question.
All right. Can you use self-direction and get residential services? Um, I think that I would need a little more detail by what you mean. Like if you're able to use self-direction while maybe living full-time in a group or congregate setting. Um,
And
it depends on,
that might
yes.
also be a good question. If you're connected with DDS and you've already gone through the eligibility process, I would have a conversation with your DDS coordinator, and they could give you, details about that. Because it really does vary depending on which model you're using and so on and so forth.
Yes, which Medicaid waiver you're using to get your services and things like that. So, fantastic questions, which are really touching upon a lot of core priorities that we've heard from our community. And I will again express my appreciation to everyone in attendance, the MA21 Coalition, and DDS for being a huge support in us, administering this survey. Please keep in touch with us. And if anyone has any other questions they want to speak out and ask, I will hang on for a little bit. So,
And if you haven't
thank you.
already, I've already dropped the chat in the chat, the link to the poll to provide us with some feedback from today. We value your feedback. We use it so that we can improve the information sessions that we host and the webinars that we provide. And so we really appreciate you taking maybe 2 minutes to answer. It's very short and brief. Oh, thank you, Lori, for your email. We will be sending out the slides. And I also want to thank the partnership that we've had with DDS. We really appreciate you being here today, Tim. The department has been incredibly helpful in partnering with us as we developed the questions for the survey, giving us really valuable feedback about how to word it, they gave us a list of different providers so that it would be easier for people to respond. And we've had incredible support on behalf of the department to help get this out to the families who are self-directing in Massachusetts. And that really helped to boost the number of respondents that we received so that we could get a better understanding about people's experiences, why they choose it, what's working well, and ways in which we can make it stronger.
Thank you, Jennifer. I appreciate that. We are, really interested in digging into the results and trying to make things better. So we appreciate the opportunity.
Right. Well, with that, I think we're wrapping up. And if folks don't have any questions, we hope you have a good rest of your night. Thank you so much again for listening in, and we'll be in touch with additional follow-up resources. Jennifer, so we could probably stop the recording now, just in case. Yeah, we'll let folks kind of filter out.
Thank you so much. Have a great night.
Thank you. Thanks for coming.
Okay, going in to stop the recording. It's not in the same menu. Let's see.